Nothing on the Bonnell Foundation's Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bonnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast, sponsored by Viatris and Genentech. Here's your host, Laura Bonnell.
Dr. Jennifer Shedden reached out to the Bonnell Foundation to see if we were interested in raising awareness about cystic fibrosis in the Hispanic community and the non-CF community, and we said yes right away. In this podcast, we talk about all the barriers that people of color face when trying to get diagnosed, and in this podcast, we focus specifically on challenges facing the Hispanic community. We now have a page on our website called CF Familia that is in both English and Spanish. It talks about CF, other resources, and CF stories from the Hispanic community. So let's dive right into the subject now. Dr. Jennifer Shedden, it's so great to have you on this podcast. I'm excited about what we're doing together, so we'll just jump right into it. Let's start talking about Genentech and Genentech's role in cystic fibrosis.
Of course. Well, we know that Genentech has definitely been, a pioneer in treatments in cystic fibrosis over 3 decades or more. And understanding that cystic fibrosis is a progressive disease, and understanding that there are needs in underrepresented populations like the Pan-Asian communities, the Latino community, the African-American community, and many others that I might not mention at this time. We decided that we needed an innovation piece. And, with the Genentech foresight, wanting to really make and understand that cystic fibrosis is no longer should be seen as just a Caucasian disease across the board with any conversation that we have. And it definitely occurs in patients of any ethnicity. So with that said, Genentech is trying to really embrace the diverse world around us, understanding that we really have to have a mission towards, delivering scientific innovations that we have better outcomes for people, patients, business, and communities, and obviously understanding and championing the part of diversity, equity, and inclusion by different pillars that we have at Genentech. And cystic fibrosis is definitely the pioneer pillar where we're developing this. This is a brand new campaign, and we wanted to focus it on Latinos with cystic fibrosis.
And why do you think, if you're able to answer this, that it took all of us so long to recognize it? Or did people recognize it, but we just weren't raising awareness enough?
I believe that the first part is that since it is a rare disease and it is not a disease that is prominent or predominant, a lot of people did understand that there was a need for rare disease development, and understanding where the medical affairs and the development of research has gone now after 2010 is where we honestly have really taken into consideration the underrepresented populations. And ever since, I believe, before the pandemic, we really understood that we have to individualize care, personalize care. And with that being said, we have to really have a renowned understanding of every population that has a rare disease. In this case would be cystic fibrosis in the case of Genentech, but Genentech is taking this program as a pilot program for all franchises. So hopefully this is going to go across the board for many illnesses like multiple sclerosis, like retinoblastoma, like FA, depending on what it is. But honestly, I think that since we've been so much endured in wanting to personalize care, it is very essential that we had to take it into consideration in a population that really has a lot of need. Now, we're not saying that everyone doesn't have a need, but the Latino population has a specific need, and with language barriers and with understanding. And over the years, no one has really focused on that population at all. So that is the main reason.
And I'm so glad that you reached out and that the Bonnell Foundation is working with you and Genentech to raise awareness. And now we have a page that is in Spanish and English, and I really have to learn to speak Spanish. As you know, my husband and one of my daughters speak Spanish, and I really have no excuse, but that, I'll work on that. But talk about this idea that you had and how you made it, come to be.
tangible, I say is
Yes.
the word. Well, this idea really came about 2 years ago. We really didn't start working on it until about a year and a half ago. And really the front lines was just the brainstorming. And then honestly, since I would say July of last year, we really were like boots on the ground. Let's see what we're going to get done. But this takes me back to, great learning. Key learnings is having that great networking and that great relationship with all the foundations, with the key physicians and with patients across the United States. Since my position is, for the whole United States, I've been working with Pulmozyme and other products about 4.5 years already. I was really drawn to going into this project because, first of all, I am Hispanic, even though people don't believe me. I speak full Espanol, completamente bilingüe. And people see me and don't see that diversity. Probably they think that I'm some other ethnicity, and then they go into detail. So with that being said, being a physician, being a caretaker, I'm always very patient-centric. Genentech brought this to the table, and I said, I would love to be a part of it and be able to lead it, at least when it comes to networking. And it has been such a roller coaster since we started, just really understanding how things are. We know that, there are protocols. There are things that when things are new, we don't know how they're going to develop. We reached out to many, over 7 associations and organizations across the United States. And really, it's something new. So nobody really believed or didn't want to share their authenticity and their identity with probably a pharma company, where you really could understand that maybe you might think that the pharma company is going to take over your identity. And that's not really what we wanted. We just really wanted to have a campaign that wasn't living on the Genentech page. We wanted to have it in conjunction with a real CF foundation. Mm-hmm. And your foundation has always been, very reciprocal to conversations, to interactions. And we appreciate so much that at the end of the day, all the hard work really paid off, and we were able to launch on May 23rd. So that is just the beginning of this road. We have so much to offer, but it's really great. And I really appreciate the fact that, the networking and the ethical background in which we always stand and how we want things to be done at Genentech, and me personally in my role, in my medical role, has definitely paid off to have this asset for, the CF Latino community.
And I think it's already paid off. And I'm so excited we're going to talk about the page specifically and what it offers. But as I told you, when I put it on Facebook and I put it on social media, the response was fabulous. People that were in the Hispanic community were sharing it, and they were so excited. Like, did you see this? Did you know? I mean, imagine if I had a language barrier, we just have to think about that. We don't always think about that. If you travel to a different country, you have to think about maybe how hard it is to figure things out. And it's so important to give access to communities that need to know about cystic fibrosis because it does impact them. So kind of describe what we have on our website, the whole Spanish side. It's also in English, but
it's in language, correct.
And how this helps the Hispanic community.
Well, I think that first of all, when we talk about any disease, we need to educate. The part of education is so key. Now, with that being said, yes, there's a lot of education, but there are a lot of education in English. And we have a huge population, over 3,000 patients in the U.S. That we know with their extended families that would like to hear about cystic fibrosis that really don't know about it. They might think they have asthma, or they have COPD, or they haven't been diagnosed adequately. And there are patients who we know that they have, mutations, and maybe their screening wasn't adequate at one point in time, depending.
About the screening, though, so that screening, so in Michigan, there is a panel that has 60 different mutations of CF, and they're the most common. So many people, because there are 2,000 mutations and it keeps growing.
Over 2,400 we know right now.
Yeah, so many people could be misdiagnosed through newborn screening. So it's something we're all working to change, but I just wanted to make sure we made that point as you were talking about it.
Correct. Where everybody's working on hopefully a law to be passed sooner than later on a state-to-state basis, and hopefully that screening will be more amplified, be able to detect patients on time. And also the fact of, re-educating the healthcare community on that. Now, with that being said, about the campaign, we wanted something to really focus in language about general information on cystic fibrosis, on really understanding what is cystic fibrosis, because a lot of people, even to the date, don't know what cystic fibrosis is. They confuse it with many other illnesses. And it happens even to the date when I speak to patients, they're like, oh, is this? Is this, multiple myeloma, or is this MS? Or, and they think of many things that have nothing to do with cystic fibrosis. And it's a genetic disorder. So definitely we have to talk about a lot of things that could happen in the person's, organ system, depending on what stage of cystic fibrosis and what treatments they're on. But with that being said, we wanted to direct something where there was general information, educational information in language with a resource so that everyone across the board in their clinics, health educators, anyone across the board could really go in and be able to honestly see something in language is very refreshing. It's very personalized, because at the end of the day, in language is always much more comfortable. Maybe someone, yes, is bilingual or is learning to speak English, but they prefer to read things in Spanish. So those are all the things that we wanted to really put up on this page. And right now we have the general information. There's going to be a lot more information, as the page develops, with educational stage books, with brochures, with testimonials and things of that sort. But the primary information is just general information on the illness, and really understanding that it doesn't have to do directly with Genentech. It doesn't have to do directly with a pharma company. It has to do with patient centricity and really personalizing information towards supporting the Latino CF community.
And this might be a silly example, but I just wanted to share this kind of language example that was in English that happened to my daughter Molly, who is in London, England. And this was before the pandemic. She had an exacerbation. She had to go to the hospital. And so she was at, some royal hospital, because they're all called royal. And so she was in the hospital, and I was asking her, are you going to get a PICC line? And she's like, nope, they didn't say anything about a PICC line. And she had been asking them, am I getting a PICC line? And they kept saying, no, we don't even know. Mm-hmm. And the next day they took her in and she got a PICC line, because they call it something else.
Exactly. Mm-hmm.
They're speaking the same language, but it was the terminology. I think they called it a long line.
Correct. Mm-hmm.
But you're speaking the same language, and yet the terminology was different. So I can't imagine speaking a completely different language and having to try and understand how things work.
Yeah, and the basis in Spanish is usually you have 20,000 ways of saying the same thing, because Spanish is spoken so diversely across the world. Every country has a specific word for something that is not just the main Spanish, from Spain. So we really wanted to keep the information and the Spanish very friendly. Let's say, patient friendly, where everyone across the board, if you're in Spain, if you're in Argentina, if you're in Bolivia, if you're in the United States, you're going to understand what we're talking about. We're not using big words. We're using very, patient-friendly words, very simple definitions, and just true facts. And, through facts, we educate ourselves. Through facts, we have a share of voice. Through facts, you can go back and just go to your physician and ask questions. There's nothing wrong with you as a patient asking the questions. Yes, we are in an era of innovation and a lot of education, but there's a lot of miseducation as well.
But I love the page, though. You have influence on there, Hispanic influencers. People can watch videos.
Correct.
They can, read the page in Spanish or in English. It has information about cystic fibrosis. And it also has a link that can take you to a support group that's
Correct.
in Spanish as well. So there are great resources on it that my foundation just didn't offer before.
Right.
And we were missing a whole group of people. And it just makes me so happy that we can now reach other people. It's
correct.
It's really important, and the feedback has been great.
With that said, Laura, I'm thinking that, on a lot of things what you're saying is, a lot of times we put limits to ourselves. A lot of times we think we're doing a lot, but we don't have that retro feedback about how well are we doing or who are we reaching, because we're all over the place. And it's about coming into something and just having that inspiration and innovation piece that maybe a lot of times we do need somebody to support us or somebody to bring an idea.
Mm-hmm.
And honestly, that's the way that I think this has developed so well, is that we have a great relationship as colleagues, and we sit down and we're patient centric. Mm-hmm. And then bringing something like this to the table really just gives that edge and that cutting edge factor that we want to do something that is really appreciated in our area, obviously in cystic fibrosis Latino community, but in cystic fibrosis or any illnesses as well.
And in Michigan, we have under 50 people that have been diagnosed that are Hispanic with cystic fibrosis. Can you tell me across the country, how big is the diagnosed CF community? And I'm guessing there will be a lot more that are diagnosed once the barriers are lifted and there's access to information.
Correct. Yeah. Right now, we know that of Latinos with cystic fibrosis diagnosed at this time are about 3,120. That definitely changes on a daily basis. Hopefully, at one point of time, we're going to have the CF registry updated. We do know that there is some lag in information due to the fact of honestly, with the pandemic this year, the information will hopefully be a lot more detailed for 2023. But that is the last information we have at this time. Now, worldwide, there is over 20,000 patients with cystic fibrosis. And we're only talking about the U.S. patients of Latino descent that are about 3,120.
Okay.
But that is something that is essential because we know that for the United States, at least the part of access and being able to opt in for adequate treatment is a little bit easier than a lot of the underdeveloped communities and countries across the world. But, it's definitely something that I think for any country, it would be of great use to be able to have this page up for them to really understand, a little bit of cystic fibrosis in the Latino communities because there are immigrants worldwide as well.
And I think we talked a little bit about what the challenges are, but can you elaborate more? Obviously, language is a challenge to finding out about cystic fibrosis or diagnosis, but we've also talked about socioeconomic and
Correct.
And
healthcare access, healthcare equity, which is huge, misdiagnosis or not really, a lot of times because of the fact that maybe they are not, legal, they think that they don't have rights or things of that sort, at least in the United States or in any other country. The Hispanic community, Latinos are very resilient, very unified community. And I think that, just being able to have that conversation with your physician or with your CF coordinator or with your primary care physician, that's why it's so important for us to really have this re-education on all levels. We're talking about from college, from when people are studying to what even if they're already, out there at their workplace and really understand that it's not just about CF clinics. It's about across the board, really just thinking of the diagnosis as a differential diagnosis and patients on their side also thinking of a diagnosis. Because at the end of the day, if you don't ask the questions, then maybe the physician doesn't even have it profiled because of your ethnicity. And that's where the health equity primary point is, that we really want to make sure and lift those blindfolds that we've had in the past to really understand that it doesn't matter what individual we have in front, doesn't matter what they look like or who they are. We need to think of everything across the board. And we are humans. Yes, we are healthcare workers and we have a lot of work. Everybody does, but we have to try and be as optimal and functional on a daily basis as possible. So that is important.
Absolutely. And we both know Terry Wright, who's African-American and was misdiagnosed until he was 54 because he kind of, I guess, didn't fit the mold, right? He didn't fit the perception
Correct.
of who could get cystic fibrosis. It isn't just white people, as you said in the beginning of this podcast, it's any ethnicity. So I think people also can relate. If you're misdiagnosed for years, and I guess the average statistic is you can be misdiagnosed for a rare disease for 7 years, you're not getting the proper treatment. You're in mental anguish because you don't know what to do and how to treat what's going on. And you're, visiting doctor after doctor. What kinds of delays is the Hispanic community seeing as far as diagnosis goes? And how is it impacting their life expectancy with the disease?
Okay. Well, the first thing is that we know that patients that aren't diagnosed in time have a mortality rate almost of double or triple what a patient nowadays that is in adequate treatment. Doesn't matter if they're on the new treatments or the standard of care therapies that have been out there for over 30 years. But that is something that is essential. Number two is we know that the Latino community definitely has a higher mortality rate if they have pulmonary exacerbations and are hospitalized. That increases almost 35%. And that is something that has been studied across the board in clinical trials. We also know that patients who are of Latino descent get more pulmonary infections that cause the exacerbation because of their rare mutations, and that causes hospitalizations, which indirectly causes higher mortality rate. as well, and higher morbidity rate. So all of these things definitely influence the fact that if they are not diagnosed in time, if they are not offered the adequate treatment that has to do with healthcare equity, access, language barriers, as we've mentioned, their environmental factors, all the socioeconomical factors, all of those things are very important because a lot of times, on the primary care level, as I mentioned before, maybe the physician is not even thinking about that and doesn't refer the patient in time. So all of those lags that we have amongst all of the things that I've already mentioned definitely increases their mortality and their life expectancy. That nowadays is double what it was 4 or 5 years ago in patients with cystic fibrosis.
So let's say you suspect that your child has cystic fibrosis, but you do have a language barrier with your doctor. I mean, I would imagine there's only one CF doctor I know in the state of Michigan who is from Bogota, Colombia, so she speaks Spanish. Dr. Zia Hernandez, she's terrific. And then growing up, I come from the Jewish community. We all had Jewish doctors. You kind of
Mm-hmm.
And it is a thing because it's your comfort zone, right? So if the Hispanic community can't find CF doctors that speak Spanish or are within their community, there's no representation. How do they go forward?
Well, I think that number one, there's great resources in the organizations where they have people within the support groups. Nowadays, there are across the board in the majority of the hospitals, there are medical translators on staff. The health educators, they're definitely trying to imply that they speak more than one language. And if not, they can reach out to the foundation. And then if they need my help, they can ask me to also speak, but the importance is that extended family, having a support group, maybe it could be another family member, another person in another state that does speak English and Spanish. And with technology nowadays, there shouldn't be, hopefully, too much limitations to the fact that we could definitely understand and be part of helping them with that. And look for their local resources as well, because a lot of the nonprofit organizations offer, translation immediately and they can help anyone with outreach as well. So that I think that it's just wanting to really find that help. And if they can't find it, we can definitely help them. And you with your organization could definitely guide them. Having the page allocated on your website, the organization's website, we could definitely be of assistance if necessary for the future as well.
Yeah, and it is on the drop down in our website under CF Familia. So
correct.
If people are looking on it for that, it's also in our show notes here. But I think too with insurance is
yes,
very challenging for anyone.
For everybody.
And if you can't read it in your own language, I would think that would be a huge challenge.
That is correct. I mean, just the education piece that has to do with insurance, with your medical office, your physician's office, with the people who surround you. If you don't have that comfort zone with the language, because even though you're probably learning English, you still, think in Spanish and you want things to be in language. Everything that we are trying to amplify right now with this campaign is hopefully going to reach from the bottom up. So that is, the main reason that we want. And there are a lot of people in the insurance companies that could help them as well. But, they're overwhelmed with work and we know that everybody has their own agenda, but that shouldn't take away from patient centricity and really being able to customize that care for that patient because it doesn't matter who it is.
Exactly. And can you share with us any challenges, either that the influencers that on our page shared or that you have heard, within the community?
Yes, definitely the main challenge is misdiagnosis, late diagnosis. We have influencers that have been living in Puerto Rico until adulthood and then have moved up to the United States. They were misdiagnosed as being asthmatic or having other types of pulmonary obstructive diseases. The other main challenge is, the care. Patients with cystic fibrosis have extreme support systems that are needed for all of their care. And sometimes they don't have, just one person, or maybe their families are working and haven't been able to support them as they needed in a lot of times. The other main challenge is health inequity. A lot of the patients a lot of physicians didn't think that they had cystic fibrosis. There are limitations within, the access with their insurance. The good thing is that, at least with Genentech has a patient foundation that does, support patients in many ways, depending on if they're using a product or not. And there are many ways that, I know that many of the foundations have their own support system as well that they can extend to patients as well. But those are like the main things are definitely the language barrier is crucial, the health inequity, and the lack of in-language support is another huge hurdle that is the main driver for this campaign as well.
How are things improving? What have you seen?
What I've seen, honestly, in the past couple of years is, at least I can speak on in general, is that I see that a lot of physicians are trying to learn a second language, and Spanish is one of them. So that is something that I feel, very proud of, that, they're going out of their way to really try and accommodate to patients. Now, we would love to learn 6, 7, 8 languages. We can't know everything, but, you have that. The main concern is definitely having that in-language support and being able to have that access and just understanding that they're not alone, that extended family that we talk about, which is our familia, is within the healthcare community as well, within the support groups as well, within their own family members, and within, anybody that definitely understands and is empathetic with the fact of having a family member or someone that they know with cystic fibrosis. That is something that we are definitely driving towards that. And the other thing that has changed, and we were talking about that, was that the fact that we are seeing that in the research and development part, we're trying to see that the development of protocols and inclusion of patients of underrepresented populations not be 0.1 or 0.2 or 0.3% that we used to see before. We're trying to at least try and engage those patients and have at least between a 3 and a 7 to 10% inclusion of patients that are from underrepresented populations. Because honestly, at the end of the day, we don't know, a lot of times we say that something is effective, but it's probably effective on an ethnical group that does not conform the underrepresented populations as well.
And we knew this before the pandemic, but a lot of people learned it during the pandemic that if you don't have representation when you're doing clinical trials, that hurts everything.
Correct.
So I know one thing is that you encourage people to get involved in clinical trials so that everyone is represented.
Correct. I try and always tell, the PIs, the investigators, and Genentech, we have a really good relationship with the R&D side, which is the research and development, with a lot of physicians there that do the development piece and ensure that, we have these conversations. When we started the project last year, we had these initial conversations like, what are you also doing on your behalf to ensure that this is going to be something that is going to be met, to actually have, real world evidence that we are trying to change how things are being done. And then all the influence, obviously, that we want to have in the conversations that we do have to impact what everybody else is doing with boots on the ground, with the volunteers, with people, with advocates, with patient advocacy, to hopefully be able to better the screening tool process and the awareness of cystic fibrosis as well.
And what are your hopes for this CF Familia campaign? What realistically can we do in these first few months or maybe the first year?
I think the realistic campaign is getting it out there that people know that it's a resource. That's not going to take 1 day, 2 weeks, anything. We just launched approximately a month ago, and we're trying to have that conversation with all of the clinics on a one-to-one basis, just so that they know, because they were aware that Genentech was doing an innovation campaign. We didn't give them a lot of details, but now that we've launched, we want to give them those details. We want to be able to express this and show this information in all of the big conferences coming up. We're hopefully going to be participating in many conferences starting July, and face-to-face conferences hopefully in the fall. So that is also something that we are going to be very present at. And then just really understand and maybe, inclusively try and do feedback surveys eventually, at the end of the year or by next year, and see how people have used it, what other information they would like on the page after we've really uploaded everything, because we're at the initial phase where we have the general information and testimonials and other things, other resources are going to be uploaded, and see how the traffic is driven. But amplifying it is not just my work, it's our work, it's everybody's networking. And we're trying to reach out to all CF foundations if possible in the US. And then hopefully we want to take it on a global level. So that is something that we want to really just have on the top of mind, which is something that is essential. And I think that, Genentech, with this whole forefront of diversity and really wanting to foster the sense of belonging, is something that we really want to be able to do on a one-to-one basis, and everybody feel identified with it as well.
And how can someone listening help? Is it through sharing the page?
Yes.
How can they help?
I believe that they would help just reposting, anything that they find on Instagram, reposting the page on Facebook, talking to family members, talking to when they have family gatherings. If it doesn't have to be someone who has cystic fibrosis, you might know someone, or, talk about these questions with their physicians, things of that sort, anything word of mouth, the way that we just share information. But, social media is such a huge part of how we do things nowadays. And it would be great. We really don't work too much with the platform of TikTok because of legality reasons, obviously, but anybody could share this information on TikTok if they want, if they want. But a lot of times the information is just, knowledge is power, patience and perseverance is key. And I think that, the way we're doing it with, not holding back, even though we had many reasons to not pursue this. As we say, we have a great team that I work with, and we were able to just have this great support system with you as well, with your foundation, and really just never let a no be something that defines how you do things, but honestly, just take it in as a yes in another form and a learning process. So that is what we really want for the campaign, is to really have it amplified on many levels, local, midterm, and probably global if possible in the long term. So
that would be wonderful. And is there anything that we didn't talk about that you wanted to mention about the campaign?
I think that, the main things that we have spoken about is, what does it bring? How is it an innovative piece? We don't know. I've yet to see any campaign like this. It's been a lot of work behind it. I completely am embedded in every possible way to be the spokesperson for the Latino community, as a physician, as a family member of an extended CF familia, as a bilingual American, and just, really want everyone to really feel that we are here to be able to support. Yes, there might be things that they want to find on the page. We don't know yet, but we are doing the best way possible right now to really just have it in Spanish, have it in English, have the resources that we would think that are, very important at the beginning. And we just want this to develop in, a huge campaign across the board, and being able to really have awareness of cystic fibrosis is something that we really need to understand, because every day that a patient is not diagnosed, every day that a patient is misdiagnosed is a day less that they will live. And that is something that is always essential. And we would like to, all of us, doctors, nurses, everybody, would love to have everything perfect. It's not a perfect world, but I think that the important part of this is just really wanting to be better on every level and making sure that we are there for the patients the best way possible.
And I'm not sure that we touched on this, but can you talk about how often are people misdiagnosed? Does it happen a lot? And how many years is diagnosis on average delayed because of misdiagnosis?
Okay. Well, we know that if patients go within their screening tool, which is, obligation across the United States. Now, worldwide is not necessarily obligation. Country to country basis is different. But we know that within the United States, which is the data that we've used for this campaign, of that screening tool, there is at least of the 100% of the patients that are screened as newborn screening, we have to have at least 20 to 30% of patients who are not diagnosed.
Wow.
Now, that is something that is essential. Why? Because of the fact that it is seen that we have, the population is a lot more nowadays. Everyone has multi-ethnical and multicultural backgrounds. And I think that that's something that a lot of people, physicians, still don't take into consideration. And we have to continue to see this. We have to continue to ensure that this doesn't happen, because the more the patients are not diagnosed, or that their misdiagnosis is embedded in another pulmonary disease or in another gastric disease or another metabolic disease, you are taking away the opportunity for that patient to have quality of life and be able to live a balanced life. The key message is to really, we need to try and change on all levels. And yes, the misdiagnosis or lack of diagnosis is something that is, I wouldn't say severe, but it is, very important, of great impact. And we just, as long as we continue to talk about this, we will definitely achieve that in a short, mid, and long term. So that is essential.
And if somebody in the Hispanic community is diagnosed through newborn screening, is their life expectancy the same as a Caucasian person, is it still 50 years old?
Their life expectancy nowadays with the new types of treatments, if they have rare mutations that go under the fact that they can use the new treatments besides the standard cares of therapy, their life expectancy is to be between 60 and 70 years of age. So that is something that is much, much better than what we used to talk about before. What we do know, as we've mentioned, is that, Latinos, the majority of the patients within the underrepresented populations do have more mortality and more morbidity, and they don't progress as well. So that is something also. And the more you deprive a patient of not having an adequate diagnosis, then we can't do the trial and error with the different therapies and make sure that they are apt, because there are new therapies, but there are many patients who haven't responded to new therapies as well. And we have to talk about that. New therapies are not just the one mold. So, everything that we're doing across the pharma world, the development world, the research world, the education piece, I think that everything goes into consideration, and we have to talk about the differences and the inequities that we have, and just understanding that every patient is not, just one fit. So that's essential as well.
Absolutely. So important. And it's really night and day for being diagnosed. I mean, my girls were diagnosed young, so thankfully we could start them on enzymes right away. But if you're not diagnosed right away, it affects your growth. It affects your lungs. It affects everything. Mm-hmm. And you really do lose time, as you've clearly said. So we're really grateful that you brought this program to us, and we are 100,000,000% behind it. So we just want people to share it and to learn from it, and because it's really important that everyone is equally diagnosed based on the disease, not on anything else, right? Exactly.
Based on signs, symptoms, historical, everything that we have to work with a patient, and really listen. I remember when I was in medical school, one of my professors in clinical anatomy, and then we went into the clinic part with rotation, says, the best part that you could do is be a great listener. And when it comes to, touching the patients, examining the patients. Nowadays, I say, medicine is a lot of times very mechanical because of the fact that you have to go through so many patients per day, and you want to really just embed yourself. But you as an individual can definitely make a difference. Just sit down and listen and listen and listen, and then ask the questions, and then use your knowledge that you have to really make an adequate diagnosis. And just teamwork is the other great support system that we have in the medical community. Is whatever you don't know, somebody else might will. So reach out to them, because a lot of times it's the way that we do things, and we have a right to sit down and speak to patients what we're thinking about. Patients can speak to us what they're thinking about as well, and be able to address all of those needs that anyone might have in front of us. So that's also essential to communication.
Right. Well said. For anybody who has some ideas for us on things to put on the page, they can definitely email the foundation or you. We'll put everything in show notes. So thanks, Dr. Jennifer Shedden, for, raising awareness about cystic fibrosis in the Hispanic community.
And thank you so much for always being there to be very reciprocal, to amplify the messaging, and we will continue these efforts. It doesn't matter, what comes along. We will continue these efforts and hopefully be able to have a big difference and impact in the Latino community with cystic fibrosis and those patients that are of Latino descent as well. So thank you very much.
The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Viatris and Genentech. It was produced by Jag and Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.